Over years of research, scientists have established that vitamin D is essential for our overall well-being. It has protective effects that works against different diseases like cancer, hypertension, diabetes mellitus, and obesity. People with vitamin D deficiency are more prone to fractures, falls, cognitive impairment, and autoimmune diseases like rheumatoid arthritis and multiple sclerosis. In Middle East, we experience hot weather most of the seasons, and even with abundant sunlight, people tend to stay indoor all year round, and this prevents them from getting enough vitamin D naturally. So people can take the vitamin D level checked every 3 to 6 months as it goes down whenever they avoid sun exposure. It can be checked through a blood test. Your doctor will determine if you have any signs of vitamin D deficiency even by speaking with you. Sun is the best source of vitamin D, and with UAE's sunlight paradise, it is relatively easy to get enough of it all year round. But sun radiation can expose you to the risk of skin cancer. This is why we call for sensible sun exposure and limited period of exposure without sunscreen. On average, a person who is not particularly vitamin D deficient needs about 15 minutes of sun exposure few times during a week. But this has to be adjusted on factors like your weight, age, complexion, and amount of skin exposed. For instance, a person who has a darker complexion should aim for 5 to 10 minutes more in the sun. The best time for sun exposure is between 10 a.m. to 3 p.m., especially in the UAE's winter months. Make sure you don't wear sunscreen as it can prevent vitamin D synthesis by 90 to 100%, but also don't stay out too long as it can cause sunburn. Standing out in the balcony, opening a window, and catching some sunlight are best ways to make some vitamin D.